Hi, this is Dr. Mir Faisal. I'm a pulmonologist. I'll be talking about COPD. COPD is a chronic obstructive pulmonary disease wherein wherein a patient has obstruction to airflow. He has a fixed obstruction to airflow. With COPD, there are certain causative causative agents like we have smoking, we have pollution, we have some hereditary factors like alpha-1 and antitrypsin deficiency. So COPD, once it sets in, continues to progress, and it's a progressive disease, and with progression it involves other systems of the body also. So it becomes a multi-organ disease. So we have to, the first thing which is involved is the lungs, and then we have the heart, and then the other tissues and other organs are also involved. So COPD, as you know, is a multi-organ disease. This is a systemic disease. It needs to be treated. So before treating, what is more important is prevention of COPD, and for prevention we need to stop smoking. Smoking is an important factor which causes COPD. So if we try to decrease the rate of smoking, so I think that is the best prevention, and we need to advise our patients. We need to inform our patients that smoking as an issue. If COPD sets in, then we can only control it. We cannot treat it 100%. So it's better that we try to avoid smoking. Smoking has an important positive factor of COPD. Then second thing is treatment adherence, which is also an important factor, because whenever a patient of COPD is there, he has to take different modalities of ranging from a simple inhaler to different drugs, to then when a patient gets sick, then he has to use oxygen, then he has to use NIVs. So it becomes a tedious job. So it is better to adhere to the treatment. So to decrease the severity of a COPD, when a patient has COPD, it's better to he follows the advice of his treating physician. So a patient who is already on drugs needs to adhere to the drugs, needs to visit his primary physician regularly, so that he is treated accordingly. Then we need to try to stop smoking also, because with smoking we increase the progression of the disease. Then second thing is rehabilitation of these patients, which is very important, and which is lacking. We try to treat the patient, we try to prevent smoking, but then the rehabilitation of the patient becomes the important thing. We have to rehabilitate these patients, because pulmonary rehabilitation is a very important factor as far as treatment of COPD is concerned. We do need to have rehabilitation centers for these patients, where these patients can go and do different exercises, so that their lung function starts again, so that they are able to breathe normally, and the function of the lung which is reduced gets increased a bit. So drugs have a role, prevention has a role, and rehabilitation has a role. So I think it's important that all the three factors are taken into consideration once a patient of COPD is seen. And most important is prevention of the disease, which is by quitting smoking, and then adherence of the drugs. And the third part is rehabilitation, which doctors and different physiotherapists do help the patient. So I think this was a short talk on COPD. I think that this will help my patients and awareness for COPD. Thank you.